Hello everyone, you're watching PhysioClassroom channel, and in this video I'm going to share with you yet another educational video which will help you in diagnosing and treating patients who come to the physiotherapy OPD with the complaints of acute cervical stiffness. Now, how to identify such patients? Such patients will give us the complaint that they were absolutely fine and then they woke up after sleeping one night early morning and they were not able to move their neck in either direction. That means they were either feeling stiffness and pain when they were trying to go down or up, and you will feel their face wincing when they are performing these actions of rotation or flexion. Now, we can treat such patients in a single session and can give them considerable relief. And if such patients are misdiagnosed, then they can end up with going through unnecessary investigations like X-ray and MRI, and they will be taking painkillers, maybe wearing a cervical collar for a long time, and can turn up into being a chronic neck patient. So all we are going to need to treat such patients will be a cervical belt. So here I have a cervical mobilization belt with me, as you can see. So what we do with such patients is we just place this belt behind the neck on the desired level. So you can choose, you can start by, if it is the early range of rotation that is affected, you can start by keeping the belt slightly up, and if it is the mid to end range of rotation that is affected, we can start by placing the belt down. So I'm going to first demonstrate how we are going to release the cervical rotational ranges, because when such patients try to move or look to one side, instead of moving the neck, they will be moving the whole body like this. And this is really uncomfortable for such patients. So let's see how we are going to treat this. So we are going to keep the belt at the desired level, and now we are going to use these two handles with a cross hold. Now what does this mean? Let's say I want to improve my rotation to the left. So what I'm going to use is I'm going to use my left hand to grab the handle that is coming from the right side, and I'm going to align the belt to the eyeball. And the other side handle is going to be grabbed by my right hand, and I'm going to keep it in a cross hold, and this is the stabilization belt and this is the mobilization handle. So now with the right hand stabilized, I'm going to use my left hand to mobilize my spine to the left, and the instruction that has to be given to the patient is just imagine as if someone is standing right behind you and you want to elbow that individual. So just try and move your elbow back, use the glide and try to turn. And always tell the patient that you have to perform this motion only when it does not gives you a sharp pain. So repeat this action and you will be astonished to see that after about 8 to 10 repetitions, the patient's pain and range of motion will be considerably improved. Perform 3 sets of 10 repetitions on one side and then 3 sets of 10 repetition on the other side. So if I have to mobilize and improve the right side, again the cross hold and mobilization. And if it is being done with the assistance of the physiotherapist can always apply overpressure in the end range. Similarly, to improve the flexion and extension ranges, we are going to use both the handles as mobilization. So we are going to again keep it towards the eyeball, give a light traction towards the eyeball, and then perform the offending motion. So extension, 10 repetitions. Now again, what can be the wrong that can be done in this mobilization maneuver is that the belt does not remain at the eyeball level, or it stays where it is and the spine starts moving. So this will become a wrong way to do it. The belt should move along the eye as we move through the range of motion. Similarly for the flexion, and voila, patient will say thank you to you and will be very happy about seeing the results and the immediate improvement. I sincerely hope that this video is going to help a lot of physios as well as a lot of patients in improving their acute stiff neck. Now, The only thing that has to be remembered is when we are treating the neck, there should be no peripheralization of symptoms going down into the upper extremity. And if that happens, one should stop doing this particular mobilization. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.